Hi, Stephanie here with Mahalo.com. We are talking about some of the psychological issues when it comes to being a parent. A big topic these days in the news is hyperactivity, ADHD. How do you know if your kid is just a busy, active child or if your child is something more than that? Perhaps your child is hyperactive, maybe needs medication. Well, joining us now to sort it all out is Dr. Sarah and Dr. Megan. Both are clinical psychologists. Thanks for being with us. Let's talk about ADHD, a bit of a controversial subject in the news these days. How do you know if your child is ADHD or just normal?
It is controversial, and it's been, people have talked about it being overdiagnosed, so it's something that we take really seriously in our practices, is making an accurate diagnosis. And I think it's important to look for a constellation of symptoms, not just one or two. Oh, you know, my child gets distracted during homework time. That could be due to a number of issues. That wouldn't be significant enough to make the diagnosis. So we have to look for a constellation of symptoms falling into a couple of different categories. So you're wanting to look at your child's attention span. Are they distractible? Are they having difficulty with organization, planning, follow through? Does your kid get really irritable when you ask them to do what seems like a simple task to you and they seem overwhelmed by the simple task? Hey, go, you know, tidy up your room. Oh, I can't. It's this huge deal, and it becomes overwhelming. And the reality is it is overwhelming to that kid. You know, they go in the room and they just see a huge mess and they can't organize how to take the steps to go about doing it. So those are some of the organizational, executive functioning types of things to look for. The hyperactive impulsivity, look for emotional things like frustration tolerance. Low frustration tolerance is really key. So if you see that your kid gets agitated quickly, overly emotional or angry about things where you think, oh, why is he or she getting so angry about that? It seems sort of simple. So I would say looking for those behavioral things and the emotional things together can help you know. Homework is a big issue. Avoiding homework, lying about homework. Saying that they forgot it, and those kinds of things, I think, are a lot of the signs to look for.
Now, great advice, it sounds like, for school-age children. Is that when we mostly see ADHD, and is it, can you see it in younger children, and also are boys or girls more likely to be diagnosed?
So to address those things, you do see it more often in boys, although girls struggle as well. Boys are generally more active and get noticed for it. I think girls may be underdiagnosed. It might not be seen as much just because of the way that girls are socialized nowadays. And yes, we can see it in younger children, but typically the diagnosis is not made until age 7. But it's still important to be aware prior to that, because even a 5-year-old could be having some significant behavioral difficulties in school, and as long as you've ruled out that it's not rooted in anxiety or depression or trauma or some other issue, you might be seeing sort of that prodromal precursor phase of the ADHD. And if you're not identifying it, you're not really knowing how to best parent your child during that age, you know, 4, 5, 6, 7. So,
what about medication? Quickly, how do you know when it's time to medicate?
I would say, I don't know if do you want to add something?
Well, I was going to say, I mean, that's usually when a psychiatrist would get involved, and a psychiatrist would do a full medication evaluation with your child. Would meet with you, with the parents, with the child, and oftentimes will also speak with the teacher and get an idea from multiple sources of the different symptoms that are being exhibited by the child. And the psychiatrist would then make that decision whether medication was appropriate.
Okay, so look for the signs, and then if you feel that you're not having any luck behaviorally, maybe it is time to take that next step and medicate.
I would say most often that happens, the school gets involved and notices that the child is having a difficulty in the classroom setting, is disruptive, that kind of thing, and will bring it to the parents' attention. That happens a lot. A lot of times kids will come into therapy and try therapy first, and if that doesn't help attenuate the symptoms and give them relief, then the therapist may at that point recommend to try the medication. I would say, generally speaking, parents are hesitant to put their young child on medication, so we often promote therapy first to see if that can alleviate symptoms, and if not, then we encourage the parent to see if the medication can be helpful if that's what they choose. All
right, well, thank you so much for some great advice when it comes to diagnosing and helping children who may be suffering from ADHD. Thank you. If you'd like more information about parenting, you can click on any of the links you see here. You can also subscribe to Mahalo Parenting And you can send us an email if you'd like a specific answer to a specific parenting topic at requests@mahalo.com. Thanks so much for watching.